Tenia Cruris infection, also known as Jock itch, is a superficial fungal infection of the groin and adjacent skin. It is characterized by intense pruritis or itching at the affected site. The most common etiological agents responsible for Tenia Cruris include Tricophyton rubrum and Epidermophyton floccosum, including sharing contaminated objects like towels, using contaminated toilets, and through direct skin-to-skin contact. Several risk factors increase the likelihood of developing the infection. These include wearing tight or wet underwear, visiting tropical climates, poor personal hygiene, and sharing clothes. Medical conditions like diabetes and obesity are also significant risk factors. Finally, overcrowding, which is common in places like prisons, military barracks, and among athletes, can facilitate its spread. Patients present with a characteristic rash in the groin area. This is accompanied by intense itching, and often there is a history of similar episodes. In an acute infection, the rash appears moist. With chronic infection, it evolves into a dry, scaly rash with well-demarcated, circular margins. Typically, the penis and scrotum are spared, though the infection may extend to the perineum and buttocks. Notably, about 50% of individuals with jock itch have a coexisting Tenia pedis or athlete's foot infection. The disease is transmitted in several ways. While Tenia Cruris doesn't usually cause serious problems, some complications can occur. These include secondary infection with candida or bacteria, hyperpigmentation or darkening of the affected skin in chronic cases, and exacerbation of the rash if mistreated with topical steroids. Furthermore, inadequate treatment can lead to recurrence and reinfection. Fortunately, treatment is effective. Tenia Cruris can be easily treated by applying topical antifungal agents like imidazoles and allylamines. Patients should be advised to clean the area with warm water without soap and dry it thoroughly before applying the ointment. Since recurrence is common, prevention is extremely important. This primarily involves minimizing the risk factors we discussed earlier.